heart attack is no longer a death sentence. Heart attacks can be almost easily be mitigated, prevented. All that you need is an awareness that these are the issues. I had a massive heart attack, and within 11 minutes, there was a balloon and a stent in my heart. This is like a world record. I mean, I have heard 1 hour, like 2 hours or 4 hours or 8 hours of delay in this matter. That is a death sentence. You need to move very, very fast, because when heart damage goes beyond a point, there is no point of return. So they put in a stent, and that basically restored the blood flow. I was completely conscious. I was looking at the whole surgery going on the computer screen. And me and the doctor, we were joking with each other. I was asking him all sorts of questions, and he was very willing to answer my questions. And women, like, you may be showering and then suddenly you feel dizzy, you want to sit down. You go to a doctor with these symptoms, a woman especially, and she will be told that nothing is wrong with you. And this is extremely dangerous. Walk 40 minutes a day, all the way to the end. I don't care if you are 90 years old, still try to walk. Because number one, you may not have a heart attack at all with walking. And even if you do get a heart attack, its intensity will be much lower. There are theories which say that cholesterol is not even relevant. It is relevant. It is extremely relevant. The point is, it is not the only factor. If you have an anger problem, like you suddenly get very angry very fast, your blood pressure can jump by 40 points. And this can precipitate a heart attack. The main thing about blood pressure medications is nobody ever thinks of stopping them or changing them. But they stop becoming effective in 4 or 5 years. Your body develops what's called resistance. Each dollar spent on green vegetables will reduce medical expense by $12.
Welcome to yet another inspiring video of What's a Pro. Today, we are joined by Mr. Milind Padki, a motivational writer who has been touching lives through his words on health and wellness. His work focuses on one of the most vital organs of all, the heart. Through his insightful writing, Milind reminds us that heart health isn't just about physical fitness, but also about emotional balance, lifestyle choices, and inner peace. He also shares his own experiences from a patient's perspective. He is a PhD level pharmaceutical scientist with 30 plus years of career experience in basic and industrial research in the pharmaceutical sciences. Let's dive into a heart-to-heart conversation about how we all can live healthier and happier lives. Please welcome Mr. Milind Padki. Welcome to What's a Pro.
Hi.
Can you tell us about your journey? Like, how did you start writing about heart and health and wellness?
Well, I was a regular writer on Facebook for a long time, about more than 10 years now. But in the COVID pandemic, it became very intense about health. Before that, I was covering the whole waterfront. But in COVID times, I started writing very intensely about immunology and the virus and the vaccines and all that. I made it a point to write in my mother tongue, Marathi, because in Maharashtra or even in the Marathi field in general, there weren't very many people going deep into the science. So I thought, let me contribute there. My master's degree was almost completely in immunology. Master's degree was in pharmacy, but it was the subject matter was in immunology. And even at my postdoc, I was working with a drug delivery system called liposomes, which is also being used in vaccinology and all that. So I'm aware of these issues, and I thought I would be useful to people.
Nice. Yeah. So before we go further, can you tell us about yourself, like what you did, your education, and your career?
Oh, well, I have a bachelor's, master's, and PhD in pharmaceutical sciences. I finished in 1986. Then my PhD in 1986. Then I came for a postdoc at University of Southern California in Los Angeles. I spent 3 years there. Then I went back to India. I worked as a scientist for 7 years. And then I came back again to the United States, and I have worked here both in industry and in academia.
Nice. But your recent posts on Facebook that I saw is mostly about heart health. Any particular reason why heart health?
Yeah, what happened was I had a massive heart attack. One night, after eating some spicy food, I started having intense pain in my upper abdomen, what is called the substernal area. I thought it was kind of, GERD, esophageal reflux disease, like, acid corroding the joint between esophagus and the stomach. And it's called GERD, and it is usually treated with a liquid antacid.
Mhm.
So I was taking Pepto-Bismol. When I took Pepto-Bismol liquid, it would decrease a lot, but it would come back again.
Mm,
And this went on almost through the night.
mm,
Next day morning, we decided to go to the local urgent care facility. They took one look and they said, "We cannot handle this. Go to a big hospital emergency room."
wow.
And we have a big hospital called Englewood Hospital nearby, like 2 miles away. We went there. They took one look at me. They did my EKG while I was standing up. They decided that I was having a massive heart attack, and they took me to the operating room. Uh, One Dr. Aaron Schwartz was the cardiologist on duty, and within 11 minutes, there was a balloon and a stent in my heart. This
Wow.
is like a world record. I mean, I have heard 1 hour, like 2 hours or 4 hours or 8 hours of delay in this matter.
Mm,
That is a death sentence. You need to move very, very fast,
mm,
because when heart damage goes beyond a point, there is no point of return.
mm,
So time is of essence. So what I would urge anyone else having this kind of a symptom is, do not wait, do not go to a normal doctor, do not go to an urgent care, go to a big hospital emergency room,
mm,
which should have what is called a cath lab, a catheter lab. Catheter lab is where they put these balloons and stents in your heart.
mm,
So the point I'm making is, make sure to locate such a hospital nearby while you are healthy,
mm,
and make sure that they have a cath lab. This will take a bit of research. This will take about 5 minutes using Google, but make sure you know where to go. So yeah, so they put in a stent, and that basically restored the blood flow.
mhm,
Now, this is done through the wrist vein. They,
mm,
they put in a catheter and it reaches the heart, and then they open the blocked
mm,
artery. And then they expand the balloon so that it becomes totally patent, as they call it, or blood flow is restored. And then to maintain the patency, they put in a metal mesh tube, and that is what we call a stent.
Mhm.
So all this was done in about 1 hour. I was completely conscious. I was looking at the whole surgery going on the computer screen.
Oh, wow.
And me and the doctor, we were joking with each other. I was asking him all sorts of questions, and he was very knowledgeable, of course, and very willing to answer my questions.
Right.
There was this young cardiologist girl there, and I looked at her and said, "This is such fun." And she said, "What? This is fun for you?" And I said, "Well, everyone is jumping around for me, and I'm having the best possible care, and I can see everything, and this is very interesting and very nice." She made a face, but whatever. And then they wheeled me to a room for recovery, and I was in that cardiology recovery room for about 2 hours.
Mhm.
Now, in this all this time, they had also taken a blood sample.
Mhm.
Uh, when um, when heart muscle is being damaged because of a heart block, there is no blood supply to that part of the heart muscle, and so those cells start dying,
Mhm.
and they release a molecule called troponin, which is a protein basically.
Mhm.
This troponin comes out in the blood, and you can determine troponin levels in the blood, and that tells you the extent of the damage and the extent of the danger.
Mhm.
Now, the point is like this, that when an heart attack starts, there is a slow rise in troponin in your blood.
Mhm.
But for the heart to become seriously damaged, it takes between 2 to 3 hours.
Mhm.
So the earlier you catch this troponin rise, the better off you are.
Mhm.
And if you are in the right cardiology department, they can quickly put a stent and solve the problem. In other words, heart attack is no longer a death sentence.
Mhm.
Heart attacks can be almost easily be mitigated,
Mhm.
prevented. All that you need is an awareness that these are the issues.
Right.
Also, see, in media, we are always shown somebody clutching his chest
Mhm.
and slowly falling down. That is about 60% of the time. other 40%, there are other symptoms, like there could be pain in the shoulder, there could be pains in the other parts of the chest. You will, of course, be out of breath.
Mhm.
You may feel dizzy. So there are multiple manifestations of a heart attack. It is not just this clutching of the chest.
Mhm.
So you should be aware of what are the various
Symptoms.
symptoms of
Yes.
the
I was
situation.
going to come. I was going to come to that. Like that was my next question.
Yeah,
Like,
yeah, sure.
what are the symptoms that we can notice while?
Uh, Primarily, it would be a pain somewhere in this area, like chest or shoulder.
Mhm.
You will be out of breath. You will feel like sitting down. You may be dizzy. You will almost certainly panic,
Mhm.
and you will sweat.
Mhm.
Now, there is something very interesting and different about women.
Mhm.
Uh, you see, this is what I am describing is a big artery, a big tube supplying blood to the heart, what
Mhm.
we call the coronary arteries. But there are also tiny capillaries all over the heart muscle, which supply the whole heart. The heart is like this size,
Mhm.
right? Fist size. And so all over the heart, there are capillaries supplying blood.
Mm,
So these tiny capillaries can also get blocked.
mm,
Those we call microemboli. And if there are a lot of them blocked, then that can also generate a heart attack.
mm,
This happened very in large numbers during COVID
mm,
because the virus causes those clots,
mm,
and then you get artery block, tiny artery blockage,
mm,
and you get a heart attack. But this is a lot more common with women for some reason than in men. And women, like you may be showering and then suddenly you feel dizzy, you want to sit down,
mm,
this feeling of tiredness. Um, you go to a doctor with these symptoms, a woman especially, and she will be told that nothing is wrong with you
wow.
and go home.
Oh,
And this is extremely dangerous.
right.
This is wrong. This should not be done to women.
Mm,
Now, microembolism is not easy to detect, because it's not like there is a large artery being blocked and you can see it on, what we call angiography.
mm,
What do they do in angiography? They inject a dye in the blood, and then the dye will travel to the heart, and you will clearly see that there is a block, like the artery has become narrow or the artery has just completely stopped flowing.
mm,
This is very easy to see,
mm,
but not in microembolism because that is not visible to the naked eye.
mm,
Uh, Now, there are more advanced machines which can use different molecules as tracer molecules, and then they can see the entire heart
mm,
and they can see these tiny blocks. But what I'm trying to get at is women need to take such episodes seriously.
mm,
Feeling of tiredness, dizziness, suddenly you want to sit down, suddenly you are at work and you feel tired and you want to go home.
mm,
See a doctor immediately and
mm.
say that I'm worried about my heart.
Oh, right.
Coming back to my situation, uh, I was kept in the hospital for 2 more nights,
Mhm,
and then I was sent home. I was given anti-clotting medications, a total of, I'm going to say, two common medications are clopidogrel and baby aspirin.
mhm,
And this is called DAPT, dual antiplatelet therapy, DAPT. This
mm,
will prevent clotting.
mm,
Uh, this is usually used between 1 and 2 years after the heart attack
mhm,
to prevent the clotting.
mm,
The downside of using this drug combination is they keep your blood liquid or thin, as they call it. They are blood thinners,
mhm.
but this can cause minor hemorrhages.
Oh,
You can get a brain hemorrhage. You can get hemorrhages in other part of the body.
mm,
So, the upside is you are not getting clotting,
mm,
but the downside is you may be getting hemorrhages.
mm. So these are
So
the side.
it's up to the doctor's judgment.
Mm,
For me, even almost 3 years after the heart attack,
mhm.
I'm still on those medications.
Wow.
The doctor had decided not to stop it.
Mhm,
So I'm still on DAPT. The other medications I'm on, am I in the right flow? Should I, yeah,
yeah.
keep
Good, good.
saying what I'm saying?
Yeah.
Please stop me if
Sure.
I'm going too fast or whatever. Is of course the cholesterol medications. Um, high cholesterol is a danger signal, and so we reduce cholesterol using statins. I am on rosuvastatins, 40 milligrams.
Mhm.
I am also on something called ezetimibe, which reduces your blood lipids.
Mhm.
And I am on something called a repatha, which is a biological and which is also used to reduce cholesterol.
Mhm.
So I would say I'm on a very intense, but probably the best clotting slash cholesterol medication regime.
Mhm.
Um, One very interesting point I should be making is that whenever issues of heart are discussed, the doctor will look at your blood pressure because high blood pressure can precipitate a heart attack.
Mhm. Yeah.
He will look at your cholesterol. He will look at your body weight.
Mm.
High body weight can precipitate these matters. And then he will tell you that you are doing fine.
Mm.
Your heart is not in danger.
Mm.
The problem with that is if your coronary arteries are becoming narrow with cholesterol deposition, none of these tests will indicate that.
Oh.
Those are two different phenomena.
Mm.
When I had my heart attack, my cholesterol was normal,
Mhm.
my blood pressure was normal, my body weight was within normal limits, not overweight,
Mhm.
and I still had a heart attack,
Right.
which means these are not adequate indicators.
Mm.
You have to test the actual heart,
Mm.
not the blood parameters.
Right.
What you need to test is the best is, of course, what is called angiography. Like I explained, that you inject a dye and see how it flows through the heart. And if there is a block, it will be apparent. Not only that, but your doctor will already have a catheter in.
Mm.
He is doing angiography, and if he sees a block, he can immediately do what's called angioplasty. He can just immediately insert a balloon and a stent.
Mhm.
So this is the best possible test to do, angiography and
Mm.
angioplasty.
Mm.
Problem is, of course, it is a very expensive affair.
Right.
It in United States it costs like $100,000
Mm.
for one time.
Mhm.
More than 99% is covered by insurance,
Mhm.
but it is a very expensive procedure. There is like a team of maybe 6 or 7 people, one very expert surgeon, and 2 or 3 days of hospital stay. So all in all, it's an expensive affair.
Yeah.
There is another, there are quite a few tests of the heart.
Mm.
For example, ultrasound, what we call echocardiogram,
ECG.
which will tell you how well the heart is pumping.
Mm.
It will tell you what is known as a ejection fraction,
Mm.
how much blood is coming in and how much of that is being pushed out.
Mm.
And it needs to be within the healthy range.
Right.
If sufficient blood is not being pushed out, then
Mm.
the ejection fraction falls. Like after my heart attack, my ejection fraction had fallen to 20%.
No.
The healthy range is 55 to 75
Oh.
or 50 to 70. I mean, there's some uh, difference of opinion. But this means that out of the blood in my heart, only 20% was being pushed out. My heart has grown that weak.
Mm.
So at that in that case, what they do is what is known as cardiac rehabilitation, rehab,
Mm.
which is a way of using exercise to to progressively strengthen your heart muscle.
Mm.
Now, this is usually a 3-month program. Uh, 3 times a week, you do about 45 minutes of exercise. In the hospital gym,
Mhm.
they put a EKG probe on your
Mhm.
chest,
Mhm.
and one nurse is constantly monitoring you that your heart is, not overstressed by the exercise.
Mhm.
And then you do about 30 minutes of what they call aerobic exercise, like running on a treadmill or on a bike,
Mhm.
and 15 minutes of weight exercise, like dumbbells or, the weights.
Mhm.
45 minutes, 3 times a week.
Mhm.
So I did this in Englewood Hospital.
Mhm.
At the end of those 3 months, my ejection fraction had climbed from 20% to 60%.
Oh, wow.
So those cardiac rehabs always
Mm.
work very well. You have to do them under expert supervision in the beginning. But after I finished those 3 months, I was told, now please continue the same protocol
Mm.
in a local community gym.
Right.
And that's what I have done throughout this last 3 years, just to keep up the practice.
Right.
Another very interesting thing which people should know is when you exercise, your heart starts developing parallel blood supply.
Mm.
Like there is an infarcted area or there is a blocked artery.
Mm.
Suppose if you are on a big freeway and the freeway is crowded and it is moving too slowly.
Mm.
Suppose you see a local exit and then there is a parallel road on which you can go,
Mm.
bypassing the main freeway.
Mm.
This is your alternate route.
Mm.
Exactly the same thing can happen in the heart.
Mm.
If you exercise routinely, your heart develops multiple such parallel routes so that even if you do have a heart attack and that particular artery is blocked,
Mm.
there are alternate pathways
Mm.
available to supply that part of the heart.
Mm. Mm.
And so what I would strongly, if this is the only thing people take away from this, from this presentation is walk 40 minutes a day,
Mm.
every day, or at least 5 days a week,
Mm.
all the way to the end.
Mm.
Till I don't care if you are 90 years old, still try to walk.
Mm.
Because number one, you may not have a heart attack at all with
Mm.
walking.
Mm.
And even if you do get a heart attack, its intensity will be much lower
Mm.
and your life will be saved.
Right.
So walking is the best thing you can do for the heart.
Right.
Parameters of walking are use good shoes,
Mm.
the so-called sneakers. They'll keep looking very nice from the top,
Mm.
but the sole has lost its, spring.
Mm.
You need support from the bottom.
Mm.
You don't care how the shoe looks from the top. You
Mm.
need good support and walk on a somewhat soft surface, like a lawn or a rubberized surface or
Mm.
just, clay,
Mm.
not on a cement surface,
Oh.
not on our usual way. Because after about 20 minutes, your feet will start hurting.
Mm.
So you need these two things, good shoes and a soft surface.
Mm. But it's very hard to get soft surface, right? Especially.
I know it's not easy, but an easy alternative is a treadmill in a gym
Mm.
or buy a treadmill at home.
Mm. Right.
But well, if you buy really good shoes and maybe you walk a little slowly, I don't know, but these are the issues that you have to care for your feet, because otherwise what happens is your feet start hurting, and after about a week you stop walking. This is the most common result.
I was actually coming to the tips on prevention. So one is walking.
Yeah, the tips on prevention is walking to develop alternate blood supply. The other is watching your cholesterol.
Mm.
Now, my insurance allows 4 times a year of what's called blood work,
Mm.
where they do, blood cell count and cholesterol and all the parameters.
Mm.
Um, but do it at least once a year.
Mm.
There are theories which say that cholesterol is not even relevant,
Wow.
but it is relevant. It is extremely relevant.
Mm.
The point is, it is not the only factor.
Mm.
We are talking about a arterial narrowing,
Mhm.
and cholesterol is one agent, but if the artery wall becomes inflamed, then also the diameter becomes lower and lower.
Mm.
So inflammation is another point.
Mm.
People will tell you, no, 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 cholesterol doesn't matter.
Mhm.
No, they are wrong.
Mm.
Cholesterol matters, but inflammation also matters.
Mm.
The problem about inflammation is that if your blood sugar is too high for too long,
Mhm.
high blood sugar is very inflammatory.
Mm.
So if you manage to reduce your blood sugar,
Mhm.
that will also reduce the inflammatory load on the heart.
Mm. Mm.
So avoid high blood sugar, avoid diabetes.
Mm.
Uh, the overweight situation is very critical and concerning. The best, you have heard of BMI,
Mhm.
not basal, um, body
Body mass.
mass index,
Mhm.
which basically divides the weight with your height, because shorter people will have lower body weight also,
Yeah.
tall people. So it is normalizing for the height. There is a mathematical expression, I don't remember that. It's probably kilograms divided by meter square in height.
Mhm.
The healthy range for, especially for Indians, is a BMI value of 22.5 to 24.1 for Indian,
Mhm.
24.5 for whites and blacks.
Mhm.
It is a little more tight for Indians because they are more prone to diabetes
Mm.
and therefore more prone to heart attacks.
Oh.
If you look at India today, there is an epidemic of diabetes and heart attacks.
Oh. Mhm.
If you maintain your blood sugar within good range for more than 5 years, your chances of getting a heart attack reduce by more than half. You
Mm.
do very well.
Mhm.
So, and the problem about Indians is most of our food is carb,
Mhm.
chapati and rice.
Mm.
And so it becomes very hard to maintain our blood sugar.
Mm.
But from a cardiac point of view, it is very critical
Mm.
that we maintain our blood sugar
Mm.
within limits. Within limits, I mean 2 hours after dinner, it should be 170 or less.
Mm.
And morning in the fasting state without eating anything, if you do it, it should be 90 and below.
Mm.
These are the healthy numbers. So that was about BMI and blood sugar.
Mhm.
We already discussed walking. We also discussed that you have to, especially if you have a family history of heart attacks,
Mm.
like your parents or your brother, your sister has had that. then definitely meet a cardiologist and let him make the decision which test to use. Everyone doesn't have to do, angiography.
Mhm.
There are easier, faster tests, but definitely see a cardiologist
Mhm.
because he can tell what is what. He will look at your family history. You should look at all your parameters and then decide.
Mhm.
Another issue I should mention in terms of prevention is baby aspirin.
Mhm.
Uh, See, the analgesic dose, like which you take for headache or for fever, is like 325 milligrams. It's a big tablet. But tiny tablets, one fourth the strength, like 81 milligrams of aspirin, are called baby aspirin.
Mhm.
And people below 60 should definitely take a baby aspirin every day.
Mhm.
This keeps your blood thin. It reduces chances of clotting.
Mhm.
Now, the American Heart Association is saying that all blood thinners have a danger of hemorrhages, right? Like internal bleeding. What American Heart Association is saying is, especially above 60,
Mhm.
do not take baby aspirin.
Mhm.
Now, I should qualify this statement.
Mhm.
Not everybody has internal bleeding. A few percent people have internal bleeding, maybe 5%,
Mhm.
which means 95% of the people are okay with aspirin.
Mhm.
But you need to be able to tell whether you have this internal bleeding problem with aspirin.
Mhm.
There are two ways of doing it. Number one is simple hemoglobin. If your hemoglobin is reducing, there is some chance that you are having an internal bleeding. Another one is called occult blood, where the bleeding in your intestines mixes with your food and your feces. And this blood is not visible to the eye, but it is easily detected biochemically. And this is called occult blood. So you can catch internal bleeding with this occult blood test. You'll have to send a blood sample to the lab, a feces sample to the lab. Also, now there are tests where after using the toilet, you can put a strip in the toilet. And if the strip changes color, then there is a chance of there being occult blood. And then you will do further workups to confirm, etc.
Mhm.
So yeah, so baby aspirin is one more way of avoiding, like preventing heart problems. Um, yeah, that is about the what can be done at a general non-medical level. Now you go to a doctor and he thinks the problem is more acute, then he's going to prescribe many more drugs and all that. But at a popular science level, we can say that this will be useful.
Mhm. So when we talk about heart health, do you like is it only like physical, or do you think like mindset and stress level that also?
Oh, definitely, definitely. You see, stress will produce what is called a high sympathetic tone, which is a state of constantly con- constricted arteries,
Mm.
and high sympathetic tone, which means high blood pressure, which means much higher chances of a heart attack.
Mm.
Also, if you have an anger problem, like you suddenly get very angry very fast, your blood pressure can jump by 40 points.
Mm.
and this can precipitate a heart attack. We
Right.
have heard many stories that, he became red, his face became red by anger, and then he had a heart attack.
Mm.
This is well known.
Yeah.
How to handle this is there are many modalities, but the most important insight is there will usually be one person in your life
Mm.
who is causing the stress.
Mm.
It
Yeah.
can be your boss, it can be your landlord, it can be your spouse. We don't know. I'm not saying divorce your spouse or give up your job, but be aware that this is the most likely scenario.
Mm.
One particular person is causing you all the stress.
Mm.
And if you decide that yes, this is a problem, talk it out
Mm.
with that person. That hey, when you say this, I get angry. When you do that, I get mad. Also, job stress, like in general, job stress. Jobs are very stressful these days. There is always a threat of job loss. Um, in today's America, you need to be loyal not to just your employer, but to your network.
Mm.
Because if you lose a job, your network can find you the next job.
Mm.
You also need to be loyal to your skill set,
Mm.
and you constantly need to upgrade your skill set to remain current in the job market.
Mm.
So there are these three levels at which you can handle stress.
Mm.
There are other modalities like yoga, like shavasana can be very useful to reduce your sympathetic tone, reduce your blood pressure. There is also religion. If you visit the temple regularly, that will reduce your stress a lot.
Mm.
So these are some of the levels you can. You need a good friend circle with whom you can talk out your problems. This friend circle should not meet just once a year, but preferably once a week. And you should be able to pick up the phone and talk to your friend.
Yeah.
So that will help a lot.
So coming back to heart health,
Yeah.
are there any myths that you come across, like taking too many painkillers, or due to COVID we get heart attacks or something? Any myths that you come across?
See, whenever we think of food in this context, we think of cholesterol.
Mm.
The problem with that is only about 20% of blood cholesterol comes from food. 80% is synthesized by your own body.
Mhm.
So if you eliminate all cholesterol from your food,
Mm.
80% is still going to be manufactured
Mm.
by your body. And if that level is excessively high, then you need to block that synthesis
Mm.
using a drug like statins.
Mm.
Um, of course, it helps to not eat high cholesterol foods like beef, red meat, especially beef, mutton, etc. But the main thing to do is do your cholesterol levels once a year at least.
Mm.
And there are at least 6 or 7 different modes of reducing cholesterol. Like cholesterol is secreted in the bile,
Mm.
but then downstream, after about 1 to 2 feet of the intestine, it gets reabsorbed in the blood.
Mm.
But if you give a ion exchange resin orally, a tablet of ion exchange resin, it will bind this cholesterol and throw it out in the toilet. It won't go back in the blood. So there are like many such models, 6 or 7 different classes of drugs.
Mm.
It just doesn't have to be statin because many people are anti-statin. There is a lot of anti-statin propaganda. But you should rely on your doctor. But he may be able to give. There is something called red yeast rice, which works like statin, but it's
Mm.
like a plant-based medication.
Mm.
That also works. So yeah, that is the main relevance of food. The other relevance is of course blood sugar, as we discussed.
Mhm.
You have to keep your blood sugar within limits.
Okay. But there are these myths, right? Especially in India, they say that after COVID vaccines, people started getting more heart attacks, or if you take like lots of painkillers out of limit, then you get heart attack. What is
Um, Painkillers do damage the kidney,
Mhm.
like especially the so-called NSAIDs, ibuprofen, naproxen, aspirin. So you should avoid excessive use. Uh, and kidney and heart these days they are almost thought of as one organ. Like
Mm,
you will always hear the word cardio-renal,
mm,
cardio, heart, renal, kidney. The problem is cardio-renal.
mm,
So anything which damages your kidney is bad for the heart also.
mm, mhm,
Um, so that was about, and there are many prescription medications which can damage the kidneys.
mm, mhm,
Blood pressure medications. The main thing about blood pressure medications is nobody ever thinks of stopping them
mm,
or changing them, but they stop becoming effective in 4 or 5 years. Your body develops what's called resistance.
mm,
So one question always to ask your doctor is, doctor, do I really need this?
mm,
Doctor, do we need to change this medication? Use
mm,
another, because there are like 20 classes of blood pressure medication.
mm,
So you can easily use a different class of medication.
mm,
But don't keep on taking it blindly.
mm,
Question that, do I need this? Do I need this? Do I need this?
mm.
Yeah.
Right. So, any tips on lifestyle change to avoid heart attack?
Um, no, I think we discussed all that. I mean, I don't know how to put this. I would strongly recommend plant-based diet.
Mhm,
If you are a meat eater, restrict how much meat you eat. Maybe once or twice a week is fine. And when we say vegetarian, it does not mean chapati and rice,
mm,
because those raise your blood sugar.
mm,
When you say vegetarian, you mean green vegetables.
mm,
Uh, you uh, you want to avoid potato, and you want to eat a lot of spinach, a lot of in any green vegetable for that matter. If you manage to eat it raw, that is even better.
mm,
Just wash them in mild food grade soap solution, because the insecticide can be on the top of the skin. So if you wash it with a lot of water, I'm like, I eat that capsicum
mhm,
raw.
mm,
You can just cut it and eat it with hummus.
mhm,
Raw is better because in cooking you lose a lot of the vitamin.
mm,
Vitamins are heat labile. They get destroyed.
mhm,
Yeah. So good. See, in America, there are areas which are called food deserts,
mm,
where all that is available is beef and potato, French fries.
mm,
The truck driver driving through Texas or whatever. This is a very poor diet. SAD, Standard American Diet, is
mm,
sad. It is going to produce heart attacks. What the insurance companies found out is, if they give out green vegetables free,
mm,
their expense of, you know, financing your illness, like heart problem, goes down a lot.
mm,
Each dollar spent on green vegetables will reduce medical expense by $12.
okay,
So
mm,
they are just, in many places, they are just giving out green vegetables for free. because that helps them reduce their own payouts.
That's interesting. Yeah. So coming to your writing,
Yeah,
so this is like a very intense topic, health.
yeah.
How do you keep it interesting so the viewers, like, so the readers are like engaged?
Um, the rule of writing is you have to meet the reader where he lives.
Mm,
You are not you're not writing to display your own learning
mm,
or your command of the language. You are not writing English literature. You are trying to help the reader. You have to make a difference in his life.
mm,
The main rule is what is called the rate of reveal. In the very first paragraph, say the most important thing.
mm,
You may have seen how newspapers report. The most important thing is in the first paragraph, and then the next paragraph, the level of importance about the news goes on decreasing, decreasing, decreasing. The most important, that is how the reader also in today's world, especially where he has 20 other things pulling at him.
mm,
Immediately give him the gist in the first paragraph.
mm.
And then if you are a good writer, he will follow on.
Yeah. So what's next for you? Like, you're writing lots of books.
Um, I am planning to write a book on heart.
Mm,
There are two or three problems with this. Number one, I am not a cardiologist, not a medical doctor, so my credibility is rather low. So I'm going to write it from a patient point of view
mm,
and from a story point of view, that this is what happened to me.
uh,
The other big problem I have is people's attention span
mm,
because of, too many things pulling at you, too many bright and beautiful things. People have like 15 or 20 seconds of attention span before something else pulls at them.
they want shorts and
If they will not read a 20-line post
yeah,
completely, why will they read a 200-page book?
yeah,
But still, people buy books.
yeah.
People don't read them, but they buy. They usually read the first paragraph, first chapter, and then it becomes shelf decoration. I will still write. I will probably produce it in ebook form
Mhm.
because that is cheaper, that can be bought anywhere in the world.
Maybe
It
audiobooks.
will probably be 150, 200 pages book. I have started collecting material. So let's see how far I go.
People are listening to audiobooks, so maybe that.
Yeah. Audiobooks is definitely. Interestingly, people will buy a print book, an ebook, and a audiobook of the same book because they use it in different contexts. Like the audiobook, they can use while driving to work.
Yeah.
Some people just like the feel of the printed book, or like I said, shelf decoration. So whatever. Yeah,
Well, thank you so much for
sure,
all your sharing all your expertise with us.
sure.
All the best for your book.
Certainly. And what I want to state is 2 years down the road from my first attack, I had a second milder heart attack.
Oh,
Okay. And but a similar treatment and all that was required.
mhm,
So on that, I want to do a second presentation.
mhm, mhm.
And there will be issues like the stent itself can be a problem,
Oh, okay.
things like that.
Mhm.
So those issues we can handle in a second, in a part B, so to speak.
So, yeah, yeah,
Okay.
yes.
All right.
Right, thank you so much.
Thank you. Yeah. Thanks for having me.